Breast cancer affects people around the globe. Some countries are harder hit than others. Breast cancer mortality rates are the highest in countries like Serbia, Belgium, Egypt, South Africa, Niger, Argentina. In the United States, over 40,000 women die each year from breast cancer. In Texas, over 15,000 women were diagnosed in 2010. That's almost the capacity of a Toyota Center basketball game. Houston is the fourth largest city in America, with a population of just over 6 million in the greater Houston area. Here, over 2,000 women were diagnosed with breast cancer in 2010. There are huge disparities between who gets the disease and who doesn't, who survives breast cancer, and who has less of a chance of beating the odds. How do we improve those odds? Help people achieve a state of complete physical, mental, and social well-being. The answer is collaboration, informed action, empowerment. True transformational change, body, mind, and spirit. Houston is the perfect incubator for big ideas, with over 40 colleges, universities, and other institutions of higher learning. Only New York City can claim more Fortune 500 headquarters. Houston is the global healthcare powerhouse. Our Texas Medical Center is the largest in the world. There's plenty of room for big ideas to grow in Houston. All they need is courage for them to become reality. St. Luke's Episcopal Health System and the Episcopal Diocese of Texas collaborated in 1997 to give birth to a really big idea: the St. Luke's Episcopal Health Charities, a one-of-a-kind mission-driven charity devoted to reducing health disparities within the most underserved and vulnerable populations throughout the Episcopal Diocese of Texas. Since then, we've had a few big ideas of our own. In April 2008, during the Big Idea exercise, Dr. Patricia Gale Bray, Executive Director of the Charities, challenged her team to dream big.
Imagine that the Charities had an extra $1 million grant to give. I want to know what your one big idea would be of how that money could be best leveraged to benefit our community.
Celine Meyer, Charities Director of Grants and Evaluations, heard the challenge, and then she had her own big idea. Celine called,
"Hey, Dorothy, this is Celine. Listen, I've got an idea."
Dorothy Weston
Hi,
Gibbons,
this is Dorothy.
the co-founder of the Rose.
Hi, Celine.
At the time of Celine's call, excitement within the Rose leadership and staff was high. The one-of-a-kind breast health portal, a web-based interactive breast health resource center and virtual navigator, had just been launched by the Charities. Her idea? What if the new breast health portal could be leveraged to connect more underserved people to breast health services within the community?
Wow, Celine, yeah, that's a really good idea.
And Dorothy was working with organizations across the state to form the Breast Health Collaborative of Texas. The timing couldn't have been better. It was a convergence of big ideas. A woman's chances of surviving breast cancer are affected by a variety of social determinants. For instance, income level. Let's take two examples here in Houston. A higher income neighborhood. This census tract is in River Oaks, and a tract from one of the poorest neighborhoods. This tract is in Westwood. These two areas are about 6 miles apart. But the distance between them and access to insurance, access to screening, and access to treatment is miles apart. In River Oaks, the population is less than 9% minority. In Westwood, most of the people here are from minority populations. In the River Oaks tract, there's a total of 1,151 households. In Westwood, there are 1,180. The women in the Westwood tract are much more likely to be the single head of a household with dependent children. And there's a significant number of households in Westwood that are living below poverty. The women in River Oaks have more education, which definitely affects income. The median household income is dramatically different for the two populations. Families in River Oaks are able to save much more of their income. In Westwood, every penny that comes in is spent. The people in Westwood are 54% less likely to be insured than the people in River Oaks. And what does this all mean when it comes to breast cancer? The women in Westwood are 28 times more likely to die of breast cancer than the women in River Oaks. This is huge. The women in Westwood are 28 times more likely to die of this disease. Why? River Oaks women are getting diagnosed as soon as they have a problem. The women in Westwood are not. They're waiting until it's too late. What is the best way to make an effective change to this inequality in health? This is where the Charities' research-informed grant-making is so important. Through our research, we're able to define what areas are the hardest hit and have the least amount of services and support. Thanks to the Charities' research-informed grant-making and operational support, the original big ideas have multiplied. The Rose leveraged the Charities' data to win additional funding for more mobile mammogram units, which will allow them to increase screenings to over 6,000 per year. The Texas Breast Health Collaborative has expanded from 35 to 272 members. With grants from both the Avon Foundation and St. Luke's Episcopal Health Charities, the collaborative has hired a full-time director and professional staff. The Rose, in partnership with the Charities, was awarded a $1 million grant by the Cancer Prevention and Research Institute of Texas, or CPRIT, to expand the Empower Her program and reach underserved populations across 10 counties. The CPRIT grant will also further fund the Rose's innovative Health Navigator program, which it launched in 1999 with Charities leadership and funding. Because of the effectiveness of our research-informed grant-making activities, Celine's original big $1 million idea has generated over $2 million worth of research and resources for the community. And it's given birth to partnerships between the Charities and powerful groups such as Susan G. Komen for the Cure, the Avon Foundation, and CPRIT to deal with breast cancer. In Houston, in Texas, nationally, and around the world. And we're not just doing this with breast cancer. The big ideas generated by St. Luke's Episcopal Health Charities mean we are launching life-changing initiatives to impact obesity, homelessness, mental illness, and more. St. Luke's Episcopal Health Charities, advancing community health, body, mind, and spirit.